Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
And welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. My name is Ellen Seppi and I'm a physical therapist coming to you live from Littleton, Colorado. I'm also 2.5 weeks postpartum. I am super stoked to talk with you guys about this topic tonight and get my brain back in gear to talk about not just babies, but also what I love, which is caring for older adults. I am so excited to talk with you about our topic tonight because it has reflected a lot of growth in my 10-year career as a physical therapist. But we're going to be talking about a big bias check in the use of strength training machines. And so for me, 10 years ago, if you would have asked me, who was a personal trainer before a physical therapist, the benefit of strength training machines, I would have scoffed. I would have said that there's no comparison between strength training machines and free weight training, which is far superior because it mimics more natural movement. It really reflects a lot of benefit for stabilizer muscles. It's much more functional. And in our MMOA courses, which are now older adult courses, we talk a lot about things like deadlifting and squatting, overhead presses, bench presses, which are all great, but this is a real opportunity for us to have an and, not, or moment to really highlight the benefits of strength training machines. And if I could tell you a story, before I went out and had my baby, whose name is Brooklyn Margot Ramacurst, by the way. I named her after my late Oma, who you may have seen in a previous podcast episode from several years ago, but her nickname was Margot, and that's my baby's middle name. Anyways, so a few months ago, I was treating a patient who had had a total joint replacement. And throughout the course of treatment, he mentioned to me that, he loved previously fishing and boating and gardening, and he had fallen. He's 75 years old because his knee had been so painful. And so he's really excited with this new knee replacement to get as strong as possible. And I mentioned to him that, physical therapy isn't just going to stop at quad sets and long arc quads. We're going to really focus on getting as strong as possible. And eventually, that's going to look like going to the gym. And he was really stoked about this. He had some experience playing sports in college and in high school. And so this was speaking his language. So we tried doing some deadlifts. We tried doing some sit to stand, some lunges. He's feeling really good. I'm feeling really good. I don't have access to machines in my clinic. So there's a little bit of he made the leap by saying, okay, hey, I got a membership at Planet Fitness and I'm going and doing strength training there like 2 or 3 times a week now. And, Ellen of 10 years ago would have been like, okay, well, that's not that great. We need to do more free weights. But Ellen of this year said, that's awesome. I'm so proud of you. This is great. And I really want to highlight the fact that strength training can have a lot of benefits. We're going to talk a little bit more about the benefits of strength training for seniors specifically. And then I'm going to talk with you about this Gym Tonic randomized controlled trial out of the 2021 European Review of Aging and Physical Activity. And we're going to talk just a little bit more about how strength training machines can really be helpful and improve adherence for a lot of our senior patients. So, okay, first thing, to talk about how there could be benefit for our senior patients, there's a lot of coordination required to get the job done right when we're doing deadlifts and squatting, and that can be daunting to some patients. A lot of patients feel like they could be doing something wrong and hurting themselves if they're doing deadlifts or overhead presses or squats, and we actually spend quite a bit of time in our courses making sure that we point out points of performance that could be improved. Now, that's not to say that those aren't wonderful and functional and necessary exercises for doing things like getting out of a chair, lifting up groceries and reaching overhead. But that could be a barrier of entry for our patients. And so instead of saying we can only do free weight exercises, let's talk about the benefits of strength training machines. So strength training machines can really be helpful to give patients confidence. They improve patients' sense of doing it correctly. A lot of times the machines have little diagrams which show where you should feel the muscles. And there's really easy ways to adjust the weights without having to, look around the gym. So they're easy to use. They give people confidence. They make people feel safe. And patients are generally compliant with both strength training with free weights and machines. So let's talk a little bit more about the specific randomized control trial that I wanted to talk about with you guys tonight. So they took 118, so researchers out of Singapore did a randomized control trial with a 12-week coach-supervised community-based strength training program using these pneumatic machines called Gymtonic. And so they did the methods to kind of, what did they look at? They looked at fast gait speed and habitual gait speed, repeated chair to sit to stand, short physical performance battery, which is an outcome measure that we really love, at 12 and 24 weeks. And so there was a control group that didn't get the strength training program yet, and a strength training program of 2 times a week, which was progressive in nature. And they looked at 15 and 10 repetition max of those strength training programs to make sure that people were really pushing it. So I appreciate that there was some, it wasn't just rate of perceived exertion here, but there was some objectivity of how hard this program was. And really, after this program, which had pretty impressive retention rates, I think it was like 75%, there was an improvement in lower extremity muscle strength, fast gait speed, regardless of where those people started. And there was a little bit of an improvement in waist circumference for those who did strength training. So long story short, there were improvements in this meaningful strength for our senior patients using these pneumatic machines that had really specific dials to take up the load for our patients. So really the take-home message here is that this community-delivered Gymtonic resistance training program with these pneumatic machines had really high adherence, improved muscle strength and fast gait speed, and can be effectively implemented at a scale for older adults. They did lat pull-downs, leg press, knee extension, leg curls, a core machine, and they had a ratio of 6 participants to 1 trainer. So it was it didn't really require one-on-one strengthening, and people got stronger. So if our take-home message from just this one study, and there are many more looking at resistance training using machines versus free weights, our take-home message here is that there's benefit to be had in both, in resistance training, power training, using machines. And if your patient is jazzed about going to Planet Fitness, then we should be jazzed too. So our take-home message here, team, is that we've got a good RCT looking at this pneumatic strength training machines, and there are some barriers to those too, knowing that they are expensive. They're not, sitting outside in parks. You need equipment that you might not have at home. But there are benefits to people feeling confident with using strength training machines and feeling like they're doing an exercise right, feeling independent with these strength training programs. We should be able to celebrate when our patients tell us that they want to do strength training on a machine at Planet Fitness or with a barbell. Both are cool in our book, and it's not it's an and not or moment for strength training with our patients. So thank you very, very much for joining me here tonight. I'm so grateful that I can share what I love and making sure that we encourage our patients throughout their lifespan, both in early years and senior years, to really milk what we have on this planet. Thank you so much for being here, and I'll look forward to seeing you in a few weeks. Thank you.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.